Dear friends, my name is Mike Schultz, and I'm the head of the spiritual care service here at Rambam. I want to talk to you today about the verse from the book of Proverbs, from Sefer Mishlei, Al tira mipachad pitom. You don't need to be scared when the fear spikes, is how I would translate it. On October 7th, the fear spiked as never before. The loss is incomprehensible, and our very sense of physical security was invaded, as so many homes were. Just 35 miles away to the north, we have the border with Lebanon. As the fears continue multiplying, we don't even know if and when all-out war in the north is going to begin as well. This beautiful pastoral scene where families and patients sit on these benches is also the helipad, where every day helicopters are arriving, bringing the wounded to be treated at Rambam, civilians and soldiers alike from the north. And Rambam continues to be on high alert. So what does the verse mean? What do we need to do with the fear? What we don't want is for the fear to control us. We don't want to have to be, the message is you don't need to be scared of the fact that you're afraid. Fear itself is a natural response, but there's so much that we can do and that we are doing already here at Rambam. So first of all, in treating patients and in helping them deal with their fear. Rifki, one of our spiritual caregivers, had an ongoing relationship already with a cancer patient. And after the war broke out, the patient called her up and said that she thinks she's too scared and she doesn't think she can come into the hospital day in and day out to do her radiation treatments. Rifki, of course, provided her with a listening ear, with an open heart. They did some of the relaxation breathing techniques that they had done previously. At the end of the day, the patient was able to calm down sufficiently to keep coming to do the life-saving treatments that she so needed. Our whole team of psychiatrists and social workers and psychologists are doing amazing work with such a variety of people, from soldiers to children to the elderly, to provide them with strength and encouragement and to provide the immediate interventions necessary to minimize the chances of developing PTSD. Secondly, I think one of the biggest fears, and this just speaks to the quality of our staff, the biggest fears for our staff is the thought, what if I wouldn't be able to continue treating my patients in wartime? The fact that Rambam has an underground fortified hospital is so incredible, such an asset to the state of Israel and to our staff here. Knowing that we, as well as the hospitals, the multiple local hospitals that would join us in the underground hospital if necessary, will be able to continue treating our patients, reducing suffering and saving lives no matter what's happening in the air above. What a huge bracha. And finally, just as we've seen how the Jewish people in Israel and around the world are coming together as one, Kol Yisrael Arivim Ze Lazeh, everyone is here for each other, showing amazing dedication, giving of themselves. So too here at Rambam. We see how the staff is supporting each other, first of all in a lot of organized ways, and also in all sorts of impromptu ways. Whether it's supporting staff members who live near the northern border and have had to leave their homes, but are still continuing to come work, treating patients. Whether it's the kind of emotional support that we need to provide to each other as we continue treating patients while mourning on the inside. And whether it's showing ourselves and the world that even across difference, we are coming together to continue the holy work of healing in body and in soul. I want to conclude by saying thank you to our hosts, Asher and Jackie Shalom. Asher and Jackie, in the merit of your friendship and compassion for the Jewish people in Israel, may you be blessed to continue to bring shalom, to continue bringing peace to the Jewish people in Los Angeles, in Haifa, and everywhere in the world. Kol Tuv.